Okay, this is redo of task 22, a urinary catheter for a male cat. So, what we have over here is our trusty cat. We've got our scrub, a flush syringe, a syringe that would be empty, but we've got pretend urine in it. Let me fix the camera here. There we go. Okay. And a red top. Okay, so here's our red top. And what we're going to do is label it with our cat's name and the date. 3/30/14. Alright, cat's name is Cat and our date. So there's our orange top. And I've got a Tomcat catheter right here, and then a good dollop of sterile lube off to the side so it doesn't get dirty. I've already shaved and removed all the long hair or major debris from the area. So what we would do now is scrub our little pretend cat here. This is Chlorhex scrub. We would scrub it pretty good. Alright. And hands. Okay. Okay, we have our catheter, and we would measure and try to decide how far to insert the catheter on the cat. So then I'm going to open this without touching the catheter and make it ready to pick up easily with our gloved hands. It will behave itself. Stay. Got docked points for contaminating my catheter last video, so get this to behave itself. So maybe I'd have my assistant hand me my catheter aseptically, typically like we do in a surgical setting. I would I would have my assistant break open the catheter packaging and hand it to me, and I would sterilely pick up my catheter. That would be one way to do that, instead of fighting with my packaging. So anyway, so we've prepped our area, we've prepared our catheter, and now let's get our gloves on. Typically I would put sterile gloves on away from the patient, but for the sake of this video, we're going to do it right here. Okay. So, like I said before, I would have my assistant present the catheter packaging, and I would pick up the catheter aseptically without touching the packaging on the catheter. Working at an emergency clinic, I'm having to do this video by myself. It's about 2:30 in the morning. So that's how I would get my catheter. I would have my assistant present it open surgically aseptic technique. So next I'm going to dip my catheter into my sterile lube here, and without touching my paper towel, without contaminating the tip of the catheter. So then I would either have my assistant present the penis, or I would do it myself, but once I touch my patient, this hand is no longer sterile, so I have to remember that when I touch things. So what we would do is we would squeeze the prepuce back and present the penis, and then introduce our catheter into our kitty cat. And And then this is a Tomcat catheter. They typically go all the way in, but if you have one that is not a Tomcat catheter, if you're using a Foley catheter or a measured catheter. So anyway, I'm holding my penis, and I've introduced my catheter into my cat. And so I would, if I'm blocked, take your syringe and flush and try to get my catheter to introduce. You saw that in the first video. So now I have my syringe that I would put on the tip of my catheter. At this point, my gloved hands are no longer sterile, but my catheter is inside my penis and dwelling in the patient. So we would draw back our urine, which I've colored with food coloring for the fun of this video. So here's our urine right here. Now on our catheter, we would either leave it in and suture it for a closed collection system, or what we would do is withdraw it slowly so that we don't damage the urethra. So with my urine, what I would do is, I've got my red top right here that we labeled with our patient name and date, and I would introduce and allow the vacuum of the container to pull my urine in. I don't want to lyse any cells that are possibly in my urine, so we're going to be nice and gentle with it. So once again, we've labeled it with our patient name and date, and what we're going to do is preferably run urinalysis right now, but we can refrigerate it if we need to. So that is task 22.